Hello, I'm Dafydd and today I'm going to be doing a shoulder examination for part of our Module 3 assessment. This is Endav. He's kindly agreed to be a patient today. For the purpose of this assessment, I'll be concentrating on examining his left shoulder, although he doesn't have any pain or any symptoms to his left shoulder. So first thing is important to expose the patient adequately, ideally from the waist upwards. From here we can have a good look at both shoulders. So we're looking for any asymmetry, any abnormal coloration of the skin, any obvious swelling and scarring. So after having a look at the front, we have a look at the side. So if you don't mind turning to the side for us. Good. And here we can have a look at the deltoid muscle, see if there's any wasting there, any other scarring from previous surgery. And we can also have a look at the curvature of the spine here to see if there's any abnormality there. After having a look at the side, we can have a look at the back. So do you mind just turning so your back faces the camera? And again, we're looking for any obvious abnormality, any asymmetry. We can look for any wasting of the supraspinatus, which is above the spine of the scapula here, and the infraspinatus here. And that looks fine. Great, okay. And after that, and do you mind just placing your hands on the wall over here in the press-up position? Great. Here we're looking for any winging of the scapula. So if you just don't mind doing a press-up on the wall. Good, okay, that's fine. And I can't see any abnormality there. All right. And then do you mind just coming back here to the position where you're in? So after having a look, we move on to feel. First of all, I like to have a general feel over the skin, over the joint, to assess the temperature and compare it to the surrounding areas. Good, and that temperature seems fine. Then we go on to a bit more specific palpation of the bony shoulder girdle, starting at the sternoclavicular joint. Tell me if you've got any pain at all when I'm pressing here. No, move on to the clavicle. And to the acromioclavicular joint there. Any pain there?
No.
Good, okay. Onwards to the acromion. I'd like to have a feel also of the glenohumeral joint here. So, do you mind just turning towards the camera again? Any pain there?
No.
No. And you can also assess if there's any wasting of the deltoid here. That's okay, okay. And do you mind just turning around again so your back faces the camera? And we can come around over the spine of the scapula and down the medial border of the scapula as well. Any pain there?
No.
Okay. At this point, I also like to have a feel of the cervical spine to see if there's got any tenderness as well. So if you've got any tenderness.
No.
No?
No.
Great, okay. And turn around again so you face the camera, please. After having a feel, we go on to movement, and we like to assess active and passive movements. So first of all, we'll assess active movements, and then if you don't mind just copying my movements, so keep your arms straight and raise them up to the ceiling like that. So first we're assessing flexion, going all the way up, that's great, okay, and then bring your arms back down, and bend your elbows, good, and push them back like that, good. Here we're assessing extension. And stretching your arms again down by your side, and lift your arms up by your side like that, all the way up as far as you can. That's assessing abduction. Okay. And bring your arms in like that again, so bend your elbows. Good. And push your arms outwards like that. Good. Here we're assessing external rotation. That's okay. Okay, and then if you don't mind turning around for us. And can you now place your hands behind your back like that? Good. And here we're assessing internal rotation. There's good movement there. Okay, that's great. If you turn around to face the camera again. So after assessing active movements, we go on to assess passive movements. By doing that, I'll place one hand on the glenohumeral joint, and then I'm just going to be taking you through the same movements we've done before. Alright, so first of all, flexion. Assess for any crepitus over the glenohumeral joint. Any pain there?
No.
Great, okay. After flexion, we go into extension. Great, and now abduction. external rotation, good. And internal rotation, good. Fine. So he's got good movement there. I then like to assess the integrity of the muscles of the rotator cuff. So first of all, we can assess supraspinatus. So if you bring your arms out like this, it's about 30 degrees of flexion, good, and internal rotation, excellent. And I'm going to be pressing down your hands there, stop me from pressing your hands down. Good, there's good power there, excellent, okay, and bring your arms in like that. Take them out to the side, okay, and then move your arms out like that for me, good. That's stopping from pressing your arms in, good. And that's assessing infraspinatus. And then we can assess subscapularis, so if you don't mind turning around again. And just with your left hand now, just place your hand at the back there, good. And push my hand outwards, good, and stop from pressing in, excellent, good. Good, and there's good power there. So some patients have difficulty in performing that movement. For those patients, we can do the belly press test. So now if you just bring your hand over your belly like that, I'll come this side, okay, take it in a bit, okay. I'll push my hand in towards your belly then. Good, and there's good power there. That's good assessment of the rotator cuff muscles, and they seem to be all intact. After that, we can move on to special tests, such as tests for impingement. We can do empty can test and Hawkins. Those are the two I perform. So first of all, with empty can test, if you abduct, bring your arms up like that. Good. So it's in the plane of the scapula and it's up to about 90 degrees. And pop your thumbs up to the ceiling. Good. And stop me from pressing your hands down. Good. Any pain up here at all when you do that?
No.
Okay, good. If you pop your hands, the thumbs down to the floor as well, okay, and stop you from pressing your hands down. Any pain there?
No.
Good. So that's the empty can test, and there's no pain there. We then move on to Hawkins test, which also assesses for impingement. So if we abduct into 90 degrees, good, and internally rotate the patient's shoulder. I'm going to cover any pain around here. So any pain there?
No.
Good. We can assess this in different variations of adduction, so test that as well. Any pain there?
No.
That's okay there. Okay. Good. So that's testing for impingement. Then we can move on to assess for any abnormality of the acromioclavicular joint. So if we're assessing the left shoulder, we're asking to bring your left hand up onto your right shoulder there. Okay, and we're looking for any pain around the acromioclavicular joint in that area. Any pain there?
No.
Good, so okay. Bring your hands down. Next of all, we can test for any instability of the shoulder. So, and if you don't mind just turning to your side, so you face the camera there, alright. And we can check for any anterior or posterior instability. So, grabbing one, securing the scapula with one hand, and then placing one hand on the humerus there, we can apply anterior force and posterior force, and we're looking for any instability there. Good, there doesn't seem to be any. We can also assess for any instability of the inferior glenohumeral joint with a sulcus sign. So again, placing one hand on the epicondyles of the humerus and one hand on the glenohumeral joint up here, we can just pull down, and we're looking for a sulcus sign, so there's a big gap that appears here if there's any instability. Doesn't seem to be any. Great, alright, thanks enough. Turn to face the camera again. So that completes my examination of the shoulder. To complete my examination, I'd also fully assess the cervical spine and the elbow and perform a neurovascular status. That's it. Thanks.